First, breaking news, Governor Gina Raimondo is again extending many of her orders on social distancing, quarantines, and business closures.
Today, the Rhode Island Department of Health announced 147 new COVID-19 cases, bringing the state's total now to more than 1,200. There are 3 more Rhode Islanders that have died, a person in their 70s at Oak Hill Center in Pawtucket and 2 residents at the Golden Crest Nursing Center in North Providence. So far, 30 have passed away from the virus. The Rhode Island Department of Health says 19 of those deaths are tied to nursing homes.
The number of people in the hospital is now at 123, an increase of 14 from yesterday. We're told 34 of those people are in intensive care. Today, Department of Health Director Dr. Nicole Alexander Scott said all essential workers should be wearing cloth face masks while working. The governor is also asking for more information from the state's hospitals.
Eyewitness News reporter Kim Kalunian joins us now live from the State House with that plus the orders the governor extended today. Kim?
Well, Mike and Shannon, many of us are wondering, when will life get back to normal and when can the economy reopen? The governor today says it is not going to happen with the flick of a switch, and she says there are many factors she has to take into consideration. And as you mentioned, today we've learned that many of her executive orders that relate to our day-to-day lives are now going to remain in effect until at least early May.
This is getting old right about now. We've been at it for 5 or 6 weeks, and it's really hard.
Governor Gina Raimondo urging Rhode Islanders to continue with COVID-19 mitigation techniques like hand washing, mask wearing, and staying at home, also keeping a daily contact journal.
It is not enough to have a mental list.
This as she extends the ban on dining in at restaurants, the prohibition of social gatherings of more than 5 people, and the mandate that out-of-state travelers self-quarantine for 14 days. All of those now in effect until May 8th. The governor also ordering hospitals to submit daily reports on coronavirus patients and the status of that in-demand PPE or personal protective equipment. Raimondo imploring everyone, regardless of their profession, to stay home if they're sick.
Nobody should be going to work if they are sick. I don't care who you are.
Dr. Nicole Alexander Scott says that's true even if you've tested negative for COVID-19.
If you got tested, you were experiencing symptoms of illness. That's the way the test works best. So that means even if you got a test that was negative for COVID-19, you still have symptoms of illness and still need to stay home.
Under the new federal stimulus, all workers are eligible for up to 10 sick days, even if they didn't previously have them. And for those who are out of work, Raimondo says apply for unemployment, but be patient as the state works through more than 100,000 claims.
We've never seen anything like this. 105,000 claims as of early this morning. We have processed more than 70,000 of those claims.
And for small businesses, tomorrow morning at 8:30 in the morning, there will be a Facebook Live hosted by the State Commerce Corporation to talk about SBA loans and other programs that are available to you. When it comes to schools and daycares, the governor says she will have further guidance on those in the coming weeks. And a programming note for tomorrow, the governor's briefing will not be held at 1 o'clock as it typically is. It will be instead at 2:30 in the afternoon, but we will still bring that to you live as it happens. For now, reporting live at the State House, I'm Kim Kalunian, Eyewitness News. A lot of the governor's executive orders now being extended, among them that ban on gatherings larger than 5 people, also the prohibition of dining in at restaurants, and the mandate for travelers coming into Rhode Island from out of state or out of the country to self-quarantine for 14 days. Those executive orders and others now extended to at least May 8th. So now the question is, how long will it be like this? Today the governor was asked what it will take to reopen the economy.
And the most important things are that we have an ability for rapid, widely available testing. We have an ability to quarantine and isolate as many people as necessary at any one time, even in a surge, and really effectively isolate people. That our hospital system is at capacity, including having necessary amount of ventilators and access to ventilators, and that we have necessary personal protective equipment across our system. I will be making announcements probably early next week, at least around how I'm thinking about reopening the economy. I will say this, There's not going to be a flick of the switch. In no scenario will I or any governor or anyone be able to say it's back to normal tomorrow. It's going to be a process, industry by industry, new regulations, industry by industry, somewhat gradually, so that we could keep everybody safe. And as you can imagine, it's going to be much more difficult to bring back online businesses who rely for their business upon large gatherings as compared to other businesses in a more controlled environment.
And a programming note, tomorrow the governor's briefing will not be at 1 o'clock when it normally is. Instead, it will be at 2:30 on Wednesday afternoon. You can still watch it live right here on WPRI 12 and online at WPRI.com. Live at the State House, I'm Kim Kalunian, Eyewitness News.